Greetings to everyone. My name is Dr. Pawan Sharma. Please do spend few minutes to watch this video. Do you have a new member coming to your family or has already come? Then heartiest congratulations and best wishes for mother and baby's health. Probably we all know that health checkup is a new norm, but do our newborn babies need any kind of health checkup or any blood test? Please read through our disclaimer and always seek professional help. Thank you. So, what are we talking about? Most of the international authorities and organizations recommend all the babies to have a health checkup. What I'm going to talk about is not all of them, but at least minimum all the babies they need are the newborn examination, or called as a baby check, a blood test for a thyroid, a hearing test, and the examination or screening of a hip joint. A newborn examination or a baby check is a detailed clinical examination supposed to be done within the 24 to 72 hours of birth, and it should be done by a trained person. A trained person does not need to be a doctor. It can be a midwife or a nurse or other health professional. What does it help? It helps in early identification of problems where early treatment and support to baby and families can be provided. Thyroid function test. This is one test I would recommend that all the newborn babies should have, because thyroid hormone is really important for development of a brain in early years of life. A low thyroid hormone in babies, if not treated well in time, can lead to significant learning difficulties and disabilities. At some places it is also called as mental retardation. The test is done by taking a small amount of blood at around the age of 5 to 7 days. Low thyroid hormone is not uncommon. It happens in one baby out of 4,000 births on an average. There are various genetic and congenital diseases which can be present from the birth but no symptoms, like thyroid hormone. Several countries, they run a program as a part of their national program to detect these diseases by doing a blood test. It's also called as Guthrie's blood spot. Now, this is not available to all the or majority of babies across the world. Next one is newborn hearing screen. As you can see from the slide that this is not uncommon. Early detection of hearing loss is really important to prevent lifelong deafness and mutism, which is inability to speak. Unfortunately, this requires a special test, and then you will have to contact the professional to get it done. Hip joint screening is actually ultrasound scan for the hip joints, which is done in babies who are at risk of developing the hip joint problem. Now, what is this problem? The developmental dysplasia of hip is actually that the hip joints are not developed properly from the birth. If it is not detected within time, then it can cause a long-term disability. Now, who are the babies who need this? Please discuss with your health professional. Oh, managed to finish my talk in less than 5 minutes. Anyway, what will be our success criteria? I think even if one baby is identified with a problem and gets help. If you liked our video, please help us to continue our journey. Thank you so much once again for listening.